What is the best way to assess diastasis recti after birth? Imagine feeling unsure about how your core is healing after giving birth. You might wonder if your abdominal muscles are still separated. That's where assessing diastasis recti comes in. The best way to check this involves a few simple steps that you can do with a healthcare provider or physical therapist. First, they usually start with a manual palpation test. You lie on your back with knees bent and feet flat on the floor. The examiner gently places their fingers along the middle of your abdomen, starting above the belly button and moving down toward the pubic bone. As you lift your head and shoulders, they feel for any gap or space between the two halves of your rectus abdominis muscles. If they feel a gap of 2 or more finger widths, that usually indicates diastasis recti. This method is quick, easy, and commonly used in clinics. For more precise measurements, tools like digital calipers or a diastometer can be used to get a numeric value of the separation. These tools help measure the exact width of the gap but are less accurate than imaging methods. The most reliable way to assess diastasis recti is with ultrasound imaging. Ultrasound allows the healthcare provider to see the linea alba, which is the connective tissue between the muscles. It provides a clear picture of how wide the separation is at different points above, at, and below the belly button. Ultrasound can also show the quality of the tissue, which helps plan the best recovery exercises. There is no strict cutoff for diagnosis, but generally, an interrectus distance of more than 2 centimeters, or roughly to finger widths, at the level of the belly button is considered significant. Measurements are often taken at multiple points to understand how extensive the separation is. In postpartum recovery, knowing the exact size and location of the diastasis helps guide safe exercises. It's important to work with a healthcare professional or physical therapist who understands postpartum healing. They can accurately assess your condition and recommend exercises that strengthen your core without risking further separation. Remember, proper assessment is key to a safe and effective recovery, so don't hesitate to seek professional help for the most accurate results.